This is the schema that we're familiar with. These are our three categories of hyponatremia in relationship to ADH. So no urine output with normal water intake. People that make no urine, doesn't matter what their ADH activity is. Compulsive water drinking with maximal but inadequate urine output. These patients have ADH maximally suppressed. And then normal water intake with decreased urine output. These are the patients that are ADH dependent, and this is what we're going to be talking about today. So remember, ADH shifts water from being excreted into the toilet and retains it into the body. And in these patients, that reduction in urine output means that they have more water intake than water excretion, and it causes hyponatremia. There are two physiologic stimuli for ADH release: increased serum osmolality and decreased perfusion. First, let's look at increased serum osmolality. This really is irrelevant when it comes to hyponatremia because this happens when you have increased osmolality or hypernatremia. So we don't need to worry about this when we're dealing with hyponatremia. In this case, all we're worried about is decreased perfusion from volume depletion or from hypotension. And these are what we're going to be discussing in the rest of the chapter: hyponatremia from volume depletion and hyponatremia from hypotension. Hyponatremia due to volume depletion. This volume depletion can be due to GI losses like diarrhea or vomiting, or renal losses like diuretics. The mechanism of action here is you get volume depletion, leads to release of ADH, decreases the urine output, leading to an imbalance with more water intake than water excretion. Hyponatremia due to hypotension. There are three causes here: heart failure, cirrhosis, and nephrotic syndrome. All of these cause decreased blood pressure or decreased perfusion. All of them are edematous states, and those are all represent hypervolemia. Again, the mechanism here is identical. Decreased perfusion leads to release of ADH, leads to decreased urine output, leading to an imbalance with more water intake than water excretion. Hypovolemia and hypervolemia both have the same mechanism of action. These two conditions are more similar than different.